So otoplasty means anything that involves changing the shape of the ear. So the most common reason to change the shape of the ears is for something called promenotia, so where your ears are too prominent and sticking out too far. That's a pretty easy issue to fix because it usually means there's a fold in your ear called the antihelix that didn't form quite well. So what I do to fix that issue is just recreate that fold. There are other reasons to have an otoplasty that involve, your ears are too pointy, or you have scarring on your ears, or you've had to have a skin cancer taken off your ears, or even born without an ear, and that's something called microtia that I can rebuild with rib cartilage. So any number of procedures on a pretty wide spectrum, but all involve making the ear look better. So what is an otoplasty like? I generally do otoplasties in the office, but they can be done in the operating room if they're a little more complex. I make an incision behind the ear, and that gives me access to all the cartilage. And I recreate the fold on the edge of the ear using stitches. And the stitches are permanent, so they want to retrain the cartilage to stay in the right shape. And then once the cartilage is the correct shape and very symmetric, then I close the incision behind the ear with dissolving stitches. I have a very soft bandage and wrap around the ears just to keep you from bumping it afterwards. And it takes about an hour in the office, so pretty simple procedure to do. So the main risk with ear surgery is getting a pocket of blood, so a hematoma, that lifts up the skin of the ear. That's really important because we want to identify that quickly and drain it. If that sticks around, it can deform the cartilage shape. Also infection, because cartilage does not have a very good blood supply, and so I want to have you on antibiotics that really penetrate the cartilage really well afterwards, because if you get an infection, again, it can permanently change the shape of the cartilage underneath the skin. Recovery afterwards is pretty straightforward. You have to keep a wrap around the ears nice and soft for a week, and then I actually have you wear a headband or something to compress the top of the ears for another 3 weeks after that. So the winter is a good time, so you can wear a hat to cover that band up. But otherwise, you can have some tenderness for a few days because cartilage tends to be more tender than other areas of the face. And then any stitches that aren't dissolvable need to come out at a week, and otherwise you're good to go.